fun when you have lots of babies in the office. So we actually have a lot of babies in our office on a regular basis these days. So we're excited. We got the whole gang here. Good morning. And thank you for joining us. Before I get started, I want to thank Senator Missy Irvin, Representative Aaron Pilkington, and other members of the legislature that are here today. Senator Irvin and Representative Pilkington have done an amazing job and have been great leaders on this effort, and just shows the great collaboration that we have with the legislature, and so thankful for everything you've done to make today possible. I also want to welcome the many doctors, nurses, and health advocates, local leaders, and of course, all of the moms and their babies and other kids that are here today. And I want to give special recognition to the leadership of the Strategic Committee on Maternal Health. Dr. Kay Chandler, Secretaries Christy Putnam and Renee Mallory, Director Janet Mann, and Dr. Sam Greenfield, who have been instrumental in helping us lead this effort and come up with a collaborative and comprehensive approach. We are also joined by Alice Walton here today, whose generous support has helped lead to the creation of the Alice Walton School of Medicine in Northwest Arkansas, and somebody who cares deeply about this issue as well as all of healthcare here in the state of Arkansas, and has been an absolutely fearless leader and advocate for making sure Arkansas is the healthiest state in the country. Thank you, Alice, for everything that you've done. It's no secret to anybody here in this room that Arkansas has to do a better job when it comes to maternal health. It's what led me to create the Strategic Committee on Maternal Health last year, and it is what has driven so many of the men and women in this room to take action. And today I'm proud that we are announcing a big step forward in our fight to improve maternal health, the Healthy Moms, Healthy Babies Act. Led by Senator Irvin and Representative Pilkington, this legislation will make several massive improvements to Arkansas's maternal health landscape. In addition to regulatory changes and incentives to bring more and better providers into maternal health care, it invests more than $45 million annually in improving maternal health for the lowest income Arkansans, and this will be transformational for our state. Thank you for your leadership. Today's step is a big one, but it's far from the first thing that this administration has done to improve maternal health. Since I received the Strategic Committee's recommendations last September, we really may have to rethink that name. It's very hard to say all at once. Our state has expanded access to prenatal care at our local health units, which are present across the state. We launched a maternal health pilot program in 5 counties with some of the worst maternal health outcomes in all of Arkansas. We secured a $17 million Transforming Maternal Health Model grant from the federal government, and we are moving forward on a statewide maternal health PSA campaign. One woman's story shows why this is so important. She lives in a small town in Arkansas and became a midwife patient at a local health unit as part of her routine care. About 30 weeks into her pregnancy, she was showing more size than expected and had other symptoms that were very concerning. The woman didn't want to go to a hospital, but the staff at the local health unit explained to her why it was so important that she seek care. They were able to convince her to go to her first visit at the local hospital, and then as her health declined, she was able to be airlifted to Little Rock. She unexpectedly delivered twins. The babies were small, but healthy, and the mom recovered from the pregnancy as normal and stayed in touch with the local health unit to receive additional care. She still has a great relationship with the midwife and the nurses who helped save her and her baby's lives. Stories like this are happening across the state. In the 5 counties where our maternal health pilot program launched, every local health unit is seeing additional pregnant women, and one has doubled its number in patients. These are healthier moms who are going to have healthy babies because of our renewed focus on this issue. The Healthy Moms, Healthy Babies Act builds on that work. It establishes presumptive eligibility for pregnant women, meaning they receive care while they're still filling out their Medicaid paperwork. It offers reimbursement for doulas and community health workers, which we know improve outcomes for hard-to-reach moms. and it establishes Medicaid coverage for moms to receive remote ultrasounds, remote blood pressure monitoring, and continuous glucose monitoring, which is huge for moms in small communities far from a hospital. These reforms will invest more than $7 million in Arkansas moms. Additionally, we will unbundle Medicaid payments for pregnancy care, covering up to 14 office visits for pre- and post-pregnancy care, and encourage providers to work with pregnant women so they attend more appointments. Of the roughly 35,000 pregnancies in Arkansas each year, 10,000 women don't see a doctor until after their first trimester, and 1,100 of those women don't see a doctor until they're actually in labor. This reform is aimed at those women and will increase Medicaid's investment in pregnant women by more than $12 million. We will also increase reimbursements for deliveries and C-sections by 70%, encouraging more providers to participate in Medicaid, increasing access to care. This is an additional nearly $26 million investment in Arkansas moms. I promise we're almost finished, but there's a lot in here. As a mom, maternal health is personal. So I'm proud to say that this legislation, along with my administration's other actions, are a massive statewide response to an important issue that is facing Arkansans. We know maternal health is complicated, and we know that it won't be improved by any one standalone policy. Today's announcement is the type of comprehensive, collaborative approach that we need to actually move the needle forward. And that's exactly what you see represented in this room, a collaborative, comprehensive approach, something I'm extremely proud that we have people from all over the state who have come together, worked together, and put the best ideas forward to help change outcomes and help change and make sure that we are a healthy state for moms and babies. I'll now turn it over to Senator Ervin and Representative Pilkington to talk a bit more about the legislation, and then let our Surgeon General, Dr. Kate Chandler, speak, and then we'll be glad to take some questions. But today is a great day to celebrate moms in Arkansas. Thank you.
I want to say how remarkable and incredible it is to have a mom in the governor's office. She's a mom that understands this topic, who cares deeply about her children, but cares deeply about all the children in the state of Arkansas. And that is shared amongst all of us in the legislature. I don't think you can find a single legislature that doesn't understand the maternal health crisis that we face in the state of Arkansas, and the idea that we all need to work collaboratively together to attack and address that problem. And so the legislation is designed to be specific, intentional, and targeted. We know where the problems exist based on the data and the research that has occurred. We want to thank Dr. Nirvana, thank you for all your work. We want to thank all the healthcare professionals for all the work that they have done to collect the data to give us a very clear picture of what we need to address and how we need to fix it. I want to thank you, Alice Walton. Thank you so much for your leadership and your passion and your concern and your care for every Arkansan, wherever they are located. You have just demonstrated an incredible amount of love for the state of Arkansas, and we are so grateful for that. For my colleagues in the Senate and the House, I am so thrilled that you are joining here us today to help us in this effort, both Republican and Democrats alike. I appreciate you. I appreciate all of your ideas. I really appreciate the dads and Representative Pilkington and all the dads that are here helping us today too. But it's really exciting. This is an exciting day. This is smart, intentional policy. Unbundling those payments are huge. Focusing on prenatal care is the right thing to do. Increasing those visits, making sure those moms get the care that they need where they are located. Increasing those payments for those hospitals will stabilize our healthcare infrastructure that we have. We can no longer see labor and delivery units closing. We have to stabilize that, and thank you so much, Governor, for what you're doing and dedicating that portion of our spend to that incredibly important piece. These moms and these babies, they deserve it. They deserve a good hospital to deliver their babies. They deserve good healthcare professionals to treat them and help them take care of themselves and their babies. I am thrilled with this legislation. It's fabulous, it's targeted, and I'm so excited to get it passed. Thank you.
Thank you, Senator. Thank you, Governor, for having us here all today. It really is a wonderful day for Arkansas to see this sort of investment into maternal health. When I first got elected, I did not think that maternal health would become a passion of mine. But in having 3 kids, I have suddenly found myself a zealot in this cause. But it's interesting too. When I first got elected, I think there was maybe 1 kid at our swearing-in ceremony. Now, when you looked at our swearing-in ceremony, you have tons of kids in the governor's office. It's amazing. And while this is important for healthcare, though, it's something we should also focus on too. Is when we think about the economy of our state, if we want a growing state, we need to have growing families. We need to have a growing population, and the best way to do that is to improve the system. The issue we've had is been here for a long time. This administration inherited a problem, and I'm glad that we're finally have a governor who's going to take this on, head on, and improve the maternal health here in this state. There's really not much more I can say that hasn't already been said, but I just want to thank everyone for being here. I want to especially thank Representative Bentley, Representative Lee Johnson, Representative Hudson, who have all been collaborative in this, and I really appreciate our willingness to always put aside our differences and try to find a way to work together, because the people of Arkansas, the children and the babies of Arkansas are what really matter here, and that's what I'm glad to see today, is that we're putting our people first, and we're going to make Arkansas one of the best places to have a baby. And I'm truly excited about this day, because this day is the starting pistol for some great change here in Arkansas.
Good morning. And it's been said, but I'll say it again. Is this not a great day for the state of Arkansas? Yes. Yes. For our moms, our babies, and our families. Thank you first. I want to say thank you to our governor for making this a priority. From the last year when she signed the executive order to supporting us through this whole process, and then in September, when we presented the plan, and then in moving things forward. So grateful. And I also want to thank you to the legislators all the legislators that have worked on this. Also, Senator Irvin, co-sponsoring with Representative Pilkington, thank you, thank you, thank you. Thank you. And all the people, our partners at DHS, in the health department that have worked on this, all the stakeholders, everybody that's been a part of making this happen, all the things that are happening, thank you. Because we are going to make the improved maternal and child and infant care and health in our state a reality. Thank you. So when I first heard about these reforms, I'm going to tell you, I was so excited. I couldn't contain myself, because I hear from throughout the state, doctors saying, we're having a hard time. We're struggling to be able to take care of women with the current way that, the reimbursement is. It's hard. We may have to stop. So I'm so excited for them to hear about this, and it's been hard to not want to share it early. But we're so super excited with this reform, the changes in the Medicaid payments, the increase, the unbundling, the presumptive eligibility, even covering the remote ultrasounds and covering blood sugar monitoring. These are new and innovative things that haven't been done, and I'm so excited about that. But I also wanted to share a few things that we've done in addition to this that have been making progress. We've made progress in all areas that we've been working on. So just a quick update, the data reporting and technology. Austin Porter is here, Dr. Porter, and many others have been working on this. There are maternal health dashboards that are through the health department, but also UAMS is working on has worked on and established a very extensive maternal health dashboard to look at things like substance use in pregnancy, depression in pregnancy, intimate partner violence in pregnancy. These are all some of these important areas that we need to address. Even the health before pregnancy, the health during pregnancy. So we will monitor these things and see how are we making improvements in these things. The clinical and practice improvements, as the governor said, we've increased the maternal care in our health department units. That's increased from 54 up to 62 now of our 95 units. Of course, we don't offer it in every unit because not every unit needs that. There's plenty of maternal care. But we are doing that in areas so that there is a place for women to go, even if they don't have a doctor. And I just want to put a plug in here. As soon as somebody knows they're pregnant, we want them to go to the doctor, make an appointment right away. Of course, if they have a doctor, an OBGYN, let's go to the doctor, the OBGYN, the family doctor, wherever you offer your prenatal care. But if you don't, you can go to the health department, your local health unit, and get free prenatal care until they can help you get established. We also have implemented community health workers in our community health units, in several of them, especially the pilot counties. And this is to help them with resources, to help them get started with the presumptive eligibility, to help them. They need things not just their health care, but they need to make sure they have transportation. They need to make sure they have housing and food. We want to make sure that we're connecting them to all their resources that are needed. Of course, we've talked about pathways and certification for both doulas and midwives. We're working and moving forward on that. Another thing I'm super excited about is the family medicine OB fellowships that are being developed. There's a new one starting through UAMS at El Dorado, and they're going to be training family medicine. They already can do obstetrics, but this will allow for a fellowship to give them even more experience so they feel very comfortable in doing that, and they're planning to expand. Also, certified nurse midwife training will start, and that'll be in 2026. So I think we're really making a difference here and making improvements and providing care to our women and our families. There's also maternal health and education, community awareness. This is huge. Education is so important. And as the governor stated, there's going to be a big marketing and education and outreach that's going to be forthcoming, and that's currently in the works, and I'm so excited about that because that will educate on the importance of breastfeeding, the importance of safe sleep after pregnancy, the importance of preconceptual care, the importance of avoiding a healthy diet, avoiding alcohol, substance use. Those are all things that are going to be addressed in this education plan. So I just wanted to, and also another thing that's been going on, I almost left this out, ADH is working with Ingeborg and UAMS on the development of a Pregnancy Plus app. Everybody likes to have an app. It's going to help with education also to help pregnant women in Arkansas to be tailored to Arkansas. So, and also ADH in conjunction with Chronic Disease Branch and Minority Health Commission has made education on hypertension and free blood pressure cuffs available for pregnant moms in Arkansas. And this is just a smattering of the things that are going on. So I just wanted to say, we know education is a priority and it's crucial. And it's been very important in our governor and her plans for the state of Arkansas in many ways. But I also wanted to share a quote of mine not mine, it's not my quote, and I'm not sure who even started it because it's been attributed to several people, but and I think it's so important and true. People don't care how much you know unless they know how much you care. And this is exemplified in the story the governor shared. The pregnant woman who went there for her visit to see the nurse practitioner, she didn't, really want to go to the hospital. She didn't understand. She thought she was a healthy pregnant mom. But after she heard from the provider and heard how she had to hear the caring. She wouldn't have done it if she didn't know she cared. So she went, and now she ended up with a healthier pregnancy, healthy outcome for her and her babies. So I believe today this is a message that is being sent loud and clear to all of us. We care about moms, their babies, and their families, and that affects all of us. We've seen today, and we've seen many times again and again, Arkansans are generous with our resources, our time, and with our hearts. Many, many generous people in this room. So what we are doing today will make a tremendous positive impact in the health and the well-being of our state. Thank you so much.
I think we're running on borrowed time here, but we'll take a couple of questions. In case you don't know, all of the babies back here are either the children of moms or spouses who work actually in the governor's office. And so just a sample of the Bring Your Baby to Work program that we piloted. We started it at DHS, but actually expanded into the governor's office just a couple months ago. And so this is actually pretty standard operating procedure here. But most of our team knows that if we're going to talk about something that I'm not super excited about, they bring the baby in and things get better all of a sudden. But with all of that, I know that we are stepping on the line here of kids running loose. And so if you have a question, we'll take a couple real quick.
Hey, Governor, from what I understand, this does not include the extended postpartum coverage. We want to see states that have expanded that coverage. Why do you think this approach is better and not including that?
As I've answered probably 20 different times from this very spot, we feel like that access to coverage exists, but we have to do a much better job of raising awareness and making sure moms are connected to it. We felt very strongly that this is a very great collaborative approach, and we really hope that each one of you will talk about the great things that are in this legislation and the great teamwork that has come together to produce something that is going to really change maternal health here in the state of Arkansas. Roby?
Concerns about funding uncertainty based on what's happening in Washington, D.C., the change in administration, some of the spending freeze, this has a price tag on it, and even more largely the Medicaid program in the state of Arkansas. Are you worried about funding?
Right now, I have no concerns. We're going to continue to work closely with the federal government and the new administration, and I feel confident we'll continue to do things that help us have healthier moms and healthier babies here in the state.
Yes, it will be. I know there's a bill filed currently called the Mama Bus. That is not the one we're using. We will have a Senate bill and a House bill that we will file this afternoon, so you guys will be able to see everything that's in it and the language that's there. So you should be getting it this afternoon.
Let's look into that. Yeah, we'll start running it as soon as we can. We'll get it filed, and to your point in the question, there will be language in the bill to make sure that we apply for whatever issues are necessary at the federal level to seek the reimbursement and the funding, but we feel confident that we'll be able to get that done.
Great. Thank you all so much. Appreciate it.